Now, with this virus, there comes a side effect. The number of people infected and affected by the COVID-19 continues to rise, as you have seen with the numbers that we've just shown you and that have reflected. And these are lives that are affected. The fear of contracting the disease is equally growing and slowly shifting to stigma. There is concern that the latter may work against the government's efforts to fight the disease. That said, the stigma appears to be yet another issue that a seemingly overwhelmed government is forced to address. Charity Mwangi reports.
Though better understood, the mystery around coronavirus, the unseen enemy, gripped Kenyans in an almost debilitating state of fear. For the first couple of months, most Kenyans rested on the notion that the disease was far removed from the immediate community. However, slowly but surely, it drew near, touching and affecting known people, even popular ones. During Charles Bukeko or Papa Shirandula's burial yesterday, there were allegations of hesitation by medics to attend to him. Medics are reportedly equally scared of the disease, whose treatment is yet to be established.
I felt it was negligence on the part of the doctors in the hospital.
Some institutions, they fear even taking in patients who are COVID.
With the increased numbers, the danger is becoming apparent, which is manifesting in fear and stigma towards those unfortunate to have been infected. The government has been vocal in seeking an end to this.
We will get people who will present with symptoms of COVID-19 in our facilities. And we should treat them just like we would treat any other person who comes in with symptoms for another disease.
While that is ideal, the real situation of stigma we find ourselves in may very well be linked to the alarmist communication around the coronavirus since the first positive patient was announced in Kenya on March 13th. The manner in which they alerted the public on the crisis at hand seemed to have set the stage for the fear and, by extension, the stigma that followed.
You should call authorities, the police, the Ministry of Health, what is the number again? 719, and inform us, that Mr. Wawero is in the street. He has just arrived from the UK, and we will pick him up.
With this kind of treatment, the idea of curfew and quarantine became scary instead of being cautionary, more fear than fact. The curfew order became a tool of brutality, all the while the contagion spread. The death toll grew, and with that, there were burials of those rumored to have suffered the disease. The burials further heightened the fear and the stigma. The heavily clad medics who accompany the body to its final resting place made the disease and those associated to the deceased be subjected to some degree of stigma. In some funerals, disclaimers are issued to ensure that the stigma is controlled.
When people in high office or who are celebrities or in media come out and pronounce their status, that is one way to destigmatize the disease.
A tricky balance this is. While it is necessary to give a picture of worst-case scenario for utmost caution, paranoia should be avoided to retain sanity. Charity Mwangi, NTV.